Interdental cleaning. This is a hot topic nowadays, especially with the increasing awareness of the gum disease. How to do it? Patients are sometimes confused when we tell them that even though they use the floss, it's not done properly. Because if you go between the teeth with the floss like that, you have two surfaces. You have one surface on the left hand side, you have one surface on the right hand side, which means once you've gone with the floss through the contact point, you have to do, as they say, letter C and reverse letter C. So it's something like this, purely because you have to clean the surface on the right hand side and the surface on the left hand side. So you stay in that space and you clean two surfaces. Once you've gone through, you stick it to one side, gently clean it, pull the floss out, then roll it between the fingers, go in the same space, curve it in the opposite way, clean the other surface again, forth and back, pop it out, and then go to the next space, and next space until you clean all the surfaces in your mouth. Unfortunately, with the age, we're losing a bit of bone support around the teeth and the little pockets that start building into the gum, purely because the gum is still there, but the bone shrinks underneath. These pockets sometimes are very difficult to be cleaned just with the floss, and this is where we start accommodating and advising for using the interdental brushes. They could be called in different names depending on the brand. They come in different sizes, in different colors, again depending on the brand. What you need to know is that when you go with that brush in between the teeth, you should feel a bit of resistance. It shouldn't be extremely loose, it shouldn't be very tight because you may damage the gum physically, but you should feel a bit of resistance. So that brush should be slightly pointed downwards, go 1 to 3 strokes and then rinse, go into the next cup, rinse, and so on. If you choose interdental brush with the long handle, you have the opportunity to go from outside of the teeth, and then you can go from the inside. Sometimes people find it's very difficult to reach the back area around the top teeth where the muscles are very tight. So when you open your mouth wide, your muscles are kind of stretching and sticking against your jawbone there. So just slightly close, relax these muscles, pop the handle and use it just to retract your cheek, to pull it away from the teeth, and then insert the brush, go a few strokes in between the teeth in that back area around the molars, rinse and go to the next space, and so on. And the other thing you can use as well when you have these spaces occurring, and also sometimes the gums are withdrawn from the teeth as well, and you have these little empty triangles that build between the teeth, and we call them black triangles because that's the way they look. Waterflossers or water picks, they're very good tools for cleaning these spaces. Again, just try to be gentle with the pressure, direct the jet towards the pocket, but not too powerful because you may damage physically the little tissues over there.